Hello everyone, I am Dr. Ankita and I welcome you back to this podcast where we'll be discussing one of the most important aspects of cancer care, the treatment options. Starting right from chemotherapy and immunotherapy to the latest advancements in cancer care. And to guide us through this very important discussion, we have with us the very renowned Senior Consultant Medical Oncologist Dr. Avinash Pandey from Patna. Thank you so much, sir, for being with us today.
Thank you. Thank you for the opportunity.
Sir, starting with the very first query, whenever a patient hears the word cancer treatment, the very first thing that comes on their mind is chemotherapy. But in today's world, there are many other treatments available to them, right? So, sir, could you please briefly explain all the other treatment available for the patients nowadays?
Yeah. So till 2 decades back, we just had three broad treatment options available for cancer patients:
Right, sir.
surgery, radiation, and chemotherapy. So in last 2 decades, we have new molecules and new drugs coming into picture. So we have now targeted therapy. We have now immunotherapy. So these are the drugs which selectively goes and kills the cancer cells only and doesn't cause any other major side effects to the patients. So normal chemotherapy goes and not only destroys tumor cells but also divides normal fast growing cells in the human body as well, which includes hairs, nails, gastrointestinal system, stomach, oral cavity. So they have still plenty of side effects with normal chemotherapy. Now these targeted agents, they are specifically targeting only the cancer cells only exclusively. So they don't have any off-target side effects that much. So the patient generally tolerates this fairly well. And now immunotherapy has come up. So immunotherapy makes the tumor and the host immunity interact in such a way that host immunity itself gets regenerated and start to kill the tumor cells without having any major side effects. So now with this targeted therapy and immunotherapy now has come in across almost every malignancies, including solid tumors as well as hematological malignancies. So now majority of the patients are receiving one or other form of targeted therapy and immunotherapy. So this is quite new. This is quite encouraging for the patients to take therapy because this has less side effects and more specificity only to tumor cell kill.
Thank you. So that's a lot of clarity. So that brings me to the next question, sir. Before we move on to the other treatment approaches, let us first learn about what is chemotherapy. Many of our patients are eager to know about what exactly is chemotherapy and how it works. If you please could explain in details.
So chemotherapy is a kind of a toxic drug.
Right, sir.
So, but it works more on those cells which are rapidly proliferating in the body. For example, tumor cells, they multiply about 20 to 50 times higher rate compared to a normal cell in the body. But there are also other cells in the body, such as a gastrointestinal system, such as a bone marrow, which produces hemoglobin, platelet, WBC, your hair, your skin, your nails. So these normal tissues also multiply at a slightly higher rate. So these chemotherapy goes and definitely kills the tumor cells, but it also has a side effect of killing other rapidly growing cells in the body, which includes skin, or causes oral mucositis, GI toxicities, including a bit of diarrhea. Then these patients can have infections because of a low WBC count. These patients can have fatigue, tiredness, weakness because of low hemoglobin. They can have mild bleeding because of low platelets. So these are off-target side effects of chemotherapy. So it goes and acts on almost every organ of the body, causing some of the other different kind of side effects in different kind of intensities. So this is what chemotherapy is. And the newer drugs, targeted and immunotherapy, are quite different the way chemotherapy works.
Thank you so much for clearing it for us. Sir, coming to the next query that we have, when patients hear the word chemotherapy, there's generally some fear attached to it as well. Also, there are a lot of stories and myths surrounding chemotherapy, right? So, sir, are basically the side effects of chemotherapy, have the other treatment approaches maybe improved this thing yet?
Yeah, so chemotherapy still happens to be one of the important treatment backbone of cancer care these days too. So in chemotherapy, basically apart from killing the tumor cells, it has some off-target side effects as well. one of the most visible side effects is the losing of hair. Especially for women, it becomes slightly more problematic and social stigma attached to it. But we have now scalp cooling devices available at several centers. So these scalp cooling devices, what it does is that it decreases the temperature of the hair and the scalp, so that the drug reach to the scalp slightly lesser amount. So the hair loss is much lesser, and hair loss, because of being lesser, the patients are able to maintain their social repute and all. So these things have been quite common. Plus, at the time when we calculate the doses of chemotherapy, we do take into account the patient's age. The patient is having a diabetic, or is a hypertensive, or has some heart problems or lung problems. We take that into consideration. We take into consideration their weight and height, and then we calculate an individualized doses to one particular patient. So for two subset of patients, the dose can be different despite of everything being same. So we individualize the drug dose in such a way so that the patient can have least possible side effects and maximum possible benefit. But still, apart from hair loss, the patient can have some hair and nail changes also. Change in the color of the nails to slightly blackening can happen. Patient can have slight oral mucositis. Some pain in swallowing could be there. Patient can have abdomen upset. Sometimes diarrhea can happen. So these are the common side effects, but then these are generally very mild and manageable. They just happen to occupy 1 or 2, 3 days of the entire 21 days of chemotherapy cycle. And vomiting was also a big issue previously, but since 2 decades we are using multiple injections and tablets to control the vomiting. So vomiting is no longer a big issue. So all these tablets and modifying the doses of chemotherapy, individualized, customized to one particular patient, decreases all the side effects significantly. So those no need to worry. Only thing is that you go and get yourself or your relatives treatment for cancer chemotherapy to a trained doctor who is equipped to handle such kind of complications and issues very well.
I think that's great to know, sir, and this is a great sign of relief for our patients as well.
Yes.
So, sir, since you talked about immunotherapy in the very beginning of this podcast, immunotherapy is a major breakthrough in cancer care, right? So, for patients who are hearing this term for the very first time, what would your suggestions be to them? Like, are they supposed to be afraid of it, or is it something that can bring them a major sign of relief?
Yeah, so immunotherapy, how it works is slightly different than what chemotherapy works. So generally the tumor itself makes an environment around the body cells in such a way so that body cells and body's immunity are not able to attack the tumor.
Right.
So for example, in pregnancy, a lady is having a baby inside his womb, but that baby is not harmed by the mother because mother's immunity is not acting against the baby. Same way, the tumor makes the environment around itself in such a way so that the body doesn't able to harm it or doesn't cause any immune reaction to develop against the tumor. So what this immunotherapy does is that it makes that switch turn off. So after switching that turn off with the use of immunotherapy, the body immunity itself invigorates itself and tries to kill the tumor cells.
Okay.
But it doesn't act in each and every one. So we generally use certain selective criteria to decide which subset of patients will have benefit of immunotherapy, which will have less benefit, which will have more benefit. So immunotherapy is basically a way of giving drug in such a way that the body's immunity itself goes and attacks the tumor cells and kills it. So now if the tumor is getting killed exclusively by the host immune system itself, the side effect profiles are very less and very manageable. So majority of the patients who are receiving chemotherapy nowadays, they don't have even 1/4 of side effects which a chemotherapy drug has. So it is very well managed. Majority of the patients who we select them to receive immunotherapy are having a benefit. And there are patients in my practice who had a stage 4 disease, who were eligible for immunotherapy. They have taken this treatment 10 years back, and now despite of having a stage 4 disease 10 years back, and now they don't have any disease, they're completely cured. So we have advanced cancers who receive immunotherapy in a particular subset of patients. They can have long-term remissions and sometimes even cure with immunotherapy if you select the patients properly in this subset of patients.
So, sir, I think this can be termed as a new sign of hope for the patients, right?
Yes.
Sir, another term that patients often come across is targeted therapy. Could you please explain what targeted therapy is actually and how it is changing the way the cancer treatment is now?
Yeah, so targeted therapy, if you have to understand that a tumor is a form of a car which we all drive, and it has steering wheel, it has one accelerator and one brake. So what happens in some subset of cancer cells or some subset of tumors, this pedal or your foot is on the accelerator for a fairly long period of time, that causes the cells to proliferate at a rapid pace. So entire things is okay except your foot is on the accelerator.
Okay.
So only one particular aspect of the tumor biology is wrong. That's only one target which needs to be targeted. If somehow you can block the accelerator or move your leg from the accelerator, the tumor will stop growing. So the entire thing, only accelerator is at fault, and only because your foot is on the accelerator. So this targeted therapy does is that, so in select subset of patients, for example in lung cancer, in breast cancer, in colon cancers, in head neck cancers, we have now targeted therapy which goes and binds on top of some selective receptor on top of a cancer cells and causes break to happen. So when they apply a brake or when they move the foot from the accelerator, something like that, the tumor stops growing. Tumor stops multiplying. Once the tumor stops growing, it automatically starts to kill itself. It's okay. So it's kind of an autophagy. The tumor already starts destroying itself, and the patient gradually comes to normal or less than normal, and near cure rates are achieved with targeted therapy. But even targeted therapy needs to be carefully selected patients. We can't give it for everyone. So we generally do some molecular testing on those cohort of patients. Something called as a fluorescent in situ hybridization, something we call as a IHC. We do select these subset of patients are going to benefit from this kind of a targeted therapy.
Okay.
This breast patient can be benefit from this therapy. Lung patient can benefit with this therapy. So especially in lung cancer, where 20 years back, these patients used to live for about only 6 months in stage 4. Now they are living for 5 years and 7 years with that one tablet a day treatment and without any major side effects. So we have a lot of patients in my practice. They were stage 4, but now they are targeted therapy. The entire stage 4 disease is totally gone now. They are just taking one tablet one day without any side effects, and they are literally cured more than 5 years, 7 years down the line. They don't have any cancer.
So great to know about the success stories, I must say. And I think targeted therapy is completely changing the picture of treatment, right?
Yes,
in cancer.
Targeted immunotherapy has changed the way we treat tumors. We're using it now day and night. Almost all patients are receiving some form of the targeted therapy or immunotherapy nowadays.
So, sir, that makes me ask you one thing. So, chemotherapy, again, getting back to chemotherapy, many patients feel that chemotherapy is always necessary for them. Is there any way that, like, using targeted therapies, the patients can avoid chemotherapy and its side effects?
Lot of tumors nowadays, for example, half of the lung cancer, then 1/3 of the breast cancer, 1/3 of the colon cancer, majority of the liver cancers, almost all of the kidney cancers, they don't need any chemotherapy.
Okay.
They can be managed with targeted therapy and or immunotherapy alone. So about, I would say, 1/3 to 40% of all the cancer treatment now are being driven by targeted therapy and immunotherapy, and chemotherapy has given way for these new drugs to come and have a major role in the treatment of patients. So a lot of tumors we can skip chemotherapy easily, provided we select the patients very properly for this kind of a treatment.
Thank you so much. It will be very relevant for our patients as well.
Sure.
So, treatment decisions can be often stressful, I feel, because the patients fear about the side effects. What are the side effects that the patients can expect from these modern treatment approaches that we discussed right now, and what are the ways to manage them?
Yeah, so one of the feared side effects initially used to be nausea, vomiting, loss of appetite. So now we are giving drugs before giving any chemo or targeted therapy. We usually give them anti-emetic drugs, either 1 or 2 tablets, and they, in 90% of the cases, are successfully able to manage any nausea and vomiting. So that is usually taken care of. Apart from that, except for chemotherapy, modern targeted therapy and immunotherapy doesn't cause any hair loss. They generally do not cause any severe diarrhea. They do not cause any mucositis. They do not cause any major rash. So they could be mild rash. They could be very mild ulcer in the hands or the mouth. These are very manageable. The patient's normal day-to-day activity is not compromised at all. He or she can do normal breathing herself, normal feeding herself, dressing herself, going to the market herself. So patients can do all regular routine activities despite of having all this chemotherapy, targeted therapy and immunotherapy. If the side effects are there, they are very, very mild. They are very, very manageable. Severe side effects are being taken care of. For example, there's one of the important side effects is blood count going down. So majority of our patients receive injections to make sure the blood count doesn't go down beyond a particular degree, so they don't land up in infections. So majority, almost 90% of the patients who are taking treatment with us, including chemotherapy, targeted immunotherapy, they generally in between 2 cycles don't come up with severe side effects. They are only with mild mucositis or mild rash or something like that, mild diarrhea, which is very manageable on OPD based phone call or SMS or WhatsApp based treatment. They don't require any admissions, or they don't require any supportive care, admissions, IV fluids, IV antibiotics, ICU care. Almost 90% of them never require. So if you go to a trained cancer physician or trained medical oncologist, he will make sure he start giving you prophylactic drugs so that these symptoms, these side effects do not happen at all in the patients, and they are very easily manageable. So patients need not bothered about these things. They are very much manageable these days.
So these treatments are extremely safe, I
Yes,
must say.
yes.
Minimal side
Yes,
effects they
yes,
have.
yes.
So thank you for that. And sir, just wanted to ask you, are there any other, apart from the treatment approaches we have just discussed, are there any other new treatment approaches for these malignancies?
Yeah, so yearly we have an annual meeting at ASCO, that is American Society of Clinical Oncology. Lot of new cancer research, molecules, targeted therapy, immunotherapy trials are going on across the world. So we have now CAR T cell therapy, so chimeric antigen receptor T cell therapy is there. So this is basically this is usually used in blood cancers. So patient whose blood cancer comes back, we take the blood sample from them, we culture in the lab, we make those T cells act against the tumor tissue, we further grow the T cells, and then we inject after a couple of weeks inside the patient's body. So patient's own T cells are now going inside the patient's body and killing the relapsed blood cancer cells inside the body. This is a new kind of a treatment which is now used in leukemias, lymphomas, and multiple myelomas, blood cancers basically. And apart from this, there are specifically engineered bispecific antibodies. So they go and kill the target particular cell, and they inject the chemotherapy drug also in that particular targeted cell. So they make the cancer treatment very exclusive and precise and specific. So it will go and kill only one X marked cell in the entire body and nowhere else. So that means the cell kill is very much higher, the side effect profile is very much manageable, the side effects are generally very mild, easily manageable on OPD basis, did not require any ICU or admission care. So these new drugs have come. For example, in pancreas, which is very difficult tumor to treat with, a new drug has been caused, dexzoramidine. So this drug inhibits the KRAS inhibitors across all spectrum. This has just been introduced 2 months back. So
the response rates are great, I've heard.
It's much improving, very fastly improving. So with pancreatic cancer, we didn't have a very good drug for a pretty long period of time. This drug has come up. So let us see, it will going to come up in India also in a couple of months down the line. So a lot of new drugs, lot of research, lot of clinical trials are going across the world. So in the coming few days, maybe year or so, we are going to see a lot of new drugs be incorporated among the Indian patients getting treatment. So we had initially only imported immunotherapy drugs. Now Indian companies are manufacturing immunotherapy drugs at a far lesser cost, at about 1/4, 1/6 of the entire cost. And many of the patients are receiving, and they're having very great benefit of these generic immunotherapy drugs. And many of my patients are on generic immunotherapy drugs. They are doing very well. In fact, one of the patients, stage 4 head neck cancer, yesterday only had a generic immunotherapy drug which cost him 15,000 compared to 2.5 lakh imported one, and within 3 cycles he had a complete response. The disease is completely gone. So these generic drugs are coming. The cancer landscape, treatment landscape is changing very fast. So you need to go and get yourself treated at a particular trained onco physician or medical oncologist, so that he knows the recent advances and makes sure your entire treatment journey remains in a safe and knowledgeable hands.
That was really, really informative, sir. And your success stories, I must say, will inspire a lot of our patients, sir.
Thank you. Thank you very much.
So lastly, when a patient gets diagnosed for the first time, it must be very overwhelming for him or her and their families, right? So what would be your advice for those families and the patients who are going through this journey now?
So first important thing, especially in majority of the cancer, is that you got diagnosed very correctly, whether it's really a cancer or not. Second important thing is to diagnose which type and grade of cancer it is. Third important thing is to diagnose the stage of the cancer. Majority of the cancer, we do a CT scan or a PET scan to find out whether the cancer is only at one site or 2 sites or multiple sites. Apart from these now, apart from a biopsy report, we generally ask for immunohistochemistry report, which confirms from where the tumor is coming. Apart from that, we sometimes use molecular markers, or sometimes called as a genetic test, called as a next-gen sequencing. So these genetic tests help us decide that the particular tumor has one target to which we have a drug available with us or not. So if the patient has a particular tumor and that has a particular mutations for which we have a particular drug, then this patient can receive that drug, which is an oral treatment generally, or sometimes the IV treatment, and the patient can be relatively cured with that oral tablet only without receiving any chemotherapy, radiation or surgery.
Okay.
So these tests, just series of tests which a person or doctor does for a particular subset of patients to find out whether the patient is eligible for X treatment, Y treatment or Z treatment. If it fits exactly into X treatment, he will receive, for example, chemotherapy. Y treatment, he will receive immunotherapy. Z, he will receive targeted therapy. For same kind of a breast cancer or lung cancer, he can have different therapy depending upon what targets that shows up in a molecular testing platform. So it is a bit exhaustive, it is a bit extensive, but it's worthwhile to get yourself evaluated across all stages of this testing so that you get the correct treatment at a proper dose for a proper time duration, and then you have a very best of all the responses and you stay healthy for a pretty long period of time.
Thank you. So you explained that beautifully, I must say.
Thank you.
So, sir, thank you so much for joining us today.
Thank you very much.
Your expert insights are relevant to many of our patients, I must say. Also, we look forward to hearing more of your expert insights in the near future again.
Sure.
Thank you once again.
Sure. Okay, thank you very much.